The year is 2025. Measles, once nearly eradicated, is making an unwelcome comeback. The United States is facing its second highest number of measles cases since the major outbreak of 2019. This surge is a stark reminder that diseases like measles can easily return, especially when vaccination rates drop. Hundreds of people are getting sick, primarily in Texas and New Mexico. This outbreak highlights the importance of vaccination in preventing the spread of this dangerous disease. We have the tools to prevent measles. The situation demands our attention. We need to understand the causes of this outbreak, the risks involved, and how to protect ourselves and our communities. This isn't just about measles, it's about taking responsibility for public health. The resurgence of measles should serve as a wake-up call. It's time to get informed, get vaccinated, and stop this preventable disease in its tracks. The epicenter of the 2025 measles outbreak lies in Texas and New Mexico. These states have become the focal points of this resurgent disease. The majority of the reported cases have emerged from these areas. This regional outbreak suggests localized factors like pockets of under-vaccination or challenges in healthcare access. Infectious diseases don't respect state lines. What starts in one area can quickly spread to others, especially with modern travel. Public health officials are working tirelessly to contain the outbreak through vaccination drives, contact tracing, and public awareness campaigns. Their efforts are crucial in preventing further spread and protecting vulnerable populations. The current measles outbreak isn't without precedent. In 2019, the United States experienced its largest measles outbreak in decades, with over 1,200 cases. This outbreak, primarily in under-vaccinated communities in New York, exposed the vulnerabilities of neglecting vaccination. More recently, in 2024, another outbreak emerged in a Chicago migrant shelter. These past outbreaks offer valuable lessons for understanding the current situation. They underscore the persistent threat of measles and the need for sustained vigilance in maintaining high vaccination coverage. Ignoring these lessons puts our communities at risk. By studying past outbreaks and implementing effective prevention strategies, we can break the cycle of measles resurgence. The lessons learned from 2019 and 2024 are crucial in navigating the current outbreak and preventing future ones. The 2025 measles outbreak in the United States is part of a larger global trend. Measles cases are rising at an alarming rate worldwide, signaling a concerning decline in vaccination rates. The World Health Organization has reported significant increases in measles cases across multiple regions. This global surge highlights the need for coordinated international efforts to combat the spread of vaccine-preventable diseases. Factors contributing to this global resurgence include misinformation about vaccines and barriers to healthcare access. The rise in measles cases globally poses a significant threat to public health, particularly in vulnerable populations. The consequences of this resurgence can be devastating, leading to serious complications, hospitalizations, and even death. The global measles crisis demands a collective response. Through international collaboration and a renewed commitment to vaccination, we can turn the tide against this preventable disease. Vaccination emerges as our most powerful weapon against the measles crisis. Vaccines are one of the safest and most effective public health interventions ever developed. The measles vaccine in particular has been proven to be highly effective in preventing infection. When administered in 2 doses, it provides over 97% immunity against this highly contagious disease. Vaccination not only protects individuals, but also contributes to herd immunity. Despite overwhelming scientific evidence, misinformation and unfounded fears have contributed to vaccine hesitancy. It's crucial to rely on credible sources of information, such as healthcare providers and public health organizations. By choosing to vaccinate, we are protecting ourselves and contributing to the health and well-being of our communities. We must prioritize vaccination as a cornerstone of public health and ensure that everyone has access to these life-saving interventions.